Okay, and now for our micronutrient component. I am so excited about this talk. It is my favorite nutrient. Um, and so Dr. Keara Taylor, one of our naturopathic doctors at Higher Health, will be inspiring us about the Take Charge vitamin, vitamin C. Dr. Keara is another serendipitous sister to me. I love how we met. I remember it was such a busy day at the office, and Dr. Keara was in her 4th year of naturopathic college, and she was coming into preceptor. She was standing at the door just watching me run all around. And I said, I need help. And so here she is. She graduated, and she was our front desk through school through her last year, and then now I'm so happy that she has joined the Higher Health team for the past couple of years now. Dr. Keara is kind. She has a calm present, always insightful, truly present to life, friends, and family, and she has the best laugh, and she is beautiful inside and out. So educate us on vitamin C, Dr. Keara.
Oh, thank you so much. So I feel like I'm sitting up straighter now, which is so nice. But I'm super excited to be chatting today, speaking on vitamin C and its many benefits to our body. And I think you'll understand why we call it our Take Charge vitamin. So I'll be speaking on what it is, how it helps us, how to take it, and how much to take. So to start with, vitamin C is an essential nutrient. So it's called ascorbic acid, and it's essential. So that means that we cannot make it in our body. So we need to get it from food or from supplements from an external source. And what vitamin C is largely known as is an antioxidant. So a lot of people have probably heard about antioxidants, but what that really means is basically an antioxidant is a molecule that can donate an extra electron to an unstable molecule. So it's going to stabilize these molecules. And these are called reactive oxygen species, and they are created through multiple processes in our body. So through normal like metabolic function, breaking down food into energy, our immune system function, even coming in contact with pollutants and toxins, which we know are kind of widespread in our environment. So all of these processes are going to create these reactive oxygen species, and then antioxidants like vitamin C are going to help stabilize them. So this is one reason why vitamin C is going to help with so many different processes in our body. Most of our cells actually utilize vitamin C. It also helps to regenerate other antioxidants like vitamin E, I'm sure a lot of people have heard of. So it's really just going to help to boost that antioxidant status. Vitamin C is also a cofactor. So a cofactor is a nutrient that's going to help an enzyme to take a process from A to B. And last week in our Glow Sisterhood call, Dr. Laura talked all about collagen and how vitamin C is a cofactor for the production of collagen. So it's going to be beneficial for skin health and all the other benefits that collagen has for us. So that's kind of why vitamin C is going to be used by so many processes in our body. But in terms of specific benefits, I wanted to start with immune health. So this is something that vitamin C, you guys probably know about vitamin C for that. It's probably one of the ways that it's most commonly known for. And it's top of mind right now, obviously. And so with our immune system, through normal immune functions, a lot of those reactive oxygen species can be created. So vitamin C is going to benefit it from that perspective. And vitamin C also actually helps to stimulate the production of our white blood cells, so things like neutrophils. So this is basically like our body's defense mechanism. Like these cells are going through our bloodstream and they're looking for injury, they're looking for a pathogen infection, and they're going to help to protect us. So when we look at the research, we look at things like colds and flus. Vitamin C is heavily studied, and we see a benefit in taking kind of like a prophylactic dose, maybe a short-term dose over a long period of time, and then really boosting up that amount right before you get a cold or a flu, like at first signs of illness. And I'll chat more about doses later, but we do see a benefit there, especially in kids' immune systems too. It can be a really, really supportive nutrient for them. And then we see it in a lot of other kind of immune conditions, so like viral infections like shingles and herpes, even pneumonia and lung conditions. Like we do see vitamin C being researched in that perspective. And another thing that a lot of people probably suffer from are allergies. We see allergies having an inflammatory component, but they actually also have an oxidative stress component. So we see high doses of vitamin C in helping with allergies. So that's really interesting. And then the second big thing that I really wanted to talk about, and I think that this is also something that all of us can kind of relate to, I think, like pandemic or not, whatever's going on, and that is our body's stress, anxiety, and our adrenal gland function. So our adrenal glands are little glands that sit on top of our kidney, and actually vitamin C is most heavily concentrated in our adrenal glands and in our brain. So those are the two areas that it's most widely found. And our adrenal glands are going to regulate our stress response. So whenever we come in contact with a stressor, which is, it communicates with the brain. So this can be something that's happening like a perceived stressor, or, you know, maybe you're running away from that tiger, or the car in front of you slams on its brakes. Your adrenal glands are going to produce neurotransmitters and hormones, so like adrenaline and cortisol. And then this is going to help our body, to help protect our body from this stress, help us manage this stress. Now, we see in research that we actually will give participants vitamin C, and then we'll put them through a stressful situation, and we'll measure their blood pressure, we'll measure their cortisol, and then we'll measure their experience of stress or anxiety. And we actually see that when they take vitamin C, they have, their blood pressure isn't as high, their cortisol is going to return back to normal faster, and then they're going to have a lower experience of stress or less anxiety. So this is really interesting. And you know, I think we've talked a bit about this on prior Sisterhood calls, but this idea that, you know, we have this sympathetic nervous system. So that's fight, flight, or freeze. So that's what's going to help us when we do come in contact with that bear, or the car slamming on its brakes, or your daughter crying. And our body's meant to then secrete those hormones, but then we have to come back down to baseline, right? We have to activate that parasympathetic rest and digest, because it's that chronic elevation of those hormones that then causes the issue. So that chronic level of stress and anxiety. So I think it's really interesting that vitamin C is so concentrated in those glands, and then they're really going to help us recover or not experience that peak as much. And I mean, I think about this in the context of confidence as well, because to me, part of confidence is knowing that I can kind of handle what life is going to throw at me, right? Like, we're all experiencing stress. We're all going to experience things that are going to be challenging for us. So knowing that we can handle them, I think, and taking care of those adrenal glands and that stress response and that nervous system, I think that's all really going to help us. And then, so the next thing I wanted to chat about as well for vitamin C is its role with hormones. So we actually see that vitamin C helps to increase progesterone levels. And we've talked about this a little bit before too, but you know, as women, obviously we have lots of hormones, and hormones are very much like a Goldilocks kind of situation. Like, we don't want too much, we don't want too little. There's kind of like a just right amount. And then that's also going to fluctuate through our cycle. But I think as a naturopath too, like what we often see with women having hormonal imbalances is often it's low progesterone can often be at the root of that. And that's because we need to ovulate in order to make progesterone, and then progesterone and like cortisol have a relationship as well. So, and like in things like perimenopause, right, we're going to see that progesterone levels like declining. So it's really interesting that vitamin C can help to increase those progesterone levels. We also see it in benefiting other kind of hormonal conditions. So things like endometriosis, which is a condition of chronic pelvic pain or really bad period cramps. And we see that inflammation is at the root of that, as well as oxidative damage. So high doses of vitamin C can help with that. Even in the case of fertility, so sperm are actually really sensitive to those reactive oxygen species, and I think our ovaries are as well. So that's why things like high doses of vitamin C and antioxidants can really benefit that as well. So, you know, there's so many benefits like a vitamin C beyond that. So even things like another one that's interesting is our ability for fatty acid oxidation. So I'm sure a lot of you have heard of that, like fat burning. So utilizing fats for fuel. And it's actually a molecule called carnitine that is going to help this process to happen. And vitamin C is also a cofactor for carnitine. And then just from like an anti-aging perspective, we know that oxidative stress is kind of at the root of aging. And in that brain, like we're seeing that high amounts of vitamin C in the brain. So that's going to benefit aging long term. So I think you can see that like there's so many different ways that vitamin C is going to benefit us. In terms of how to get it, so we can get vitamin C through our food. I think a lot of us think of the citrus fruits, so that's one way to get vitamin C. The other really high sources are things like bell peppers and guava and kiwi. So basically with vitamin C, like and cooking also will kind of impact some of the bioavailability of that. So you can just keep that in mind. But with, so the RDA, which is like the recommended dietary amount of vitamin C, is set at about 75 milligrams. And that is set to help prevent scurvy. So vitamin C deficiency is what we see in a condition called scurvy. So it's like bleeding gums, sore joints, things like that. So you're probably meeting those requirements through your diet, but then to get, we're always about kind of optimal health. So depending on what your health status is, what your health goals are, the amount that you need for your body might be different. So in terms of supplements, there's probably like 3 main ways to get it. So we have just the oral supplement, we have a liposomal supplement, and then the IV therapy. So with the oral, the main issues with oral is just that so when we have vitamin C, it's absorbed in our small intestine through transporters. So basically that means that like the vitamin C molecules have to hop in this transporter to get into our bloodstream. So those are going to saturate at a certain amount. So you'll only be able to absorb a certain amount that way. And then the other factor is vitamin C is one that if you have too much of it, it can cause like gastric distress, loose stools, things like that. So in the research, we see kind of about probably 2 grams will be like the maximum that someone can have, but this will be on a case by case basis, depending on how much your body can tolerate. And then with liposomal, so liposomal is the vitamin C is encased in a lipid molecule. So that can help with the absorption. So you can absorb a little bit more of that. And it has a longer half-life. So it'll stay in your bloodstream a little bit longer. But then there's vitamin C. And I think a lot of you guys know that we love vitamin C at Higher Health, the IV therapy, because what happens is those nutrients are delivered directly into your bloodstream. So they bypass that digestive part. So, they're not going to be maxed by the transporters. They're not going to cause that gastric distress. And we actually have research on this where someone will be given an oral dose and then they'll be given an IV dose, and we can measure the amount in the bloodstream. And we see that with the IV dose, it's actually up to 70 times higher. So it's just going right into that bloodstream, and you're getting that high dose right in your bloodstream, as I said. So, vitamin C it's excreted through the kidneys. So it is water soluble. So we are going to see those levels kind of return to baseline probably about kind of like 24 hours later. So the thing with the dose is that the research is really wide. The range of doses is really wide. So it's really going to be, I think, on a case by case, like individual basis to determine which is the right dose for you, because we see in the research that it's very safe. Quite high doses are safe of vitamin C. When we get really high in clinic, we talk about a blood test that we have to run to make sure that you don't have an enzyme deficiency, but that's usually at high doses. So we always talk to our patients about that. But in terms of the kind of like 10-gram dose that we normally do, we see that that's quite safe. And then just because, the dose that's going to be best for you will really depend on what your health status is, what your goals are. And it might be like a lower prophylactic dose and then a higher dose, or it could be higher dose for a while to really, because we're really trying to saturate those tissues. So they're getting that benefit of the vitamin C. So hopefully that was resonant for all of you. I just think that it's so interesting how this nutrient can affect so many areas of our body. And again, bringing it back to confidence and thinking like, as a woman, when I feel like I can handle, whatever life is going to throw at me, I feel like I'm in tune with my stress response, when my hormones are balanced and, I'm feeling like myself. And then when I have, confidence in my immune system too, that it's going to keep me healthy. I think, that's what confidence is all about. So hopefully that was interesting on our Take Charge nutrient, vitamin C.
Thank you so much, Keara. And yes, we could talk for hours about vitamin C and all its benefits. I've always loved vitamin C, but especially through this whole isolation period, I've just really come to appreciate the oral dosing as well as the IV dosing. So if you have any questions about vitamin C, please email us. And coming back to our 4 words, we're just wrapping up here, and we have another gift for you at the end. So we spoke at the beginning that, and if you have a pen and a piece of paper with you, write these down. Our words from our panelists that were selected were authentic, connected to self, strong in self, and trusting of self. And actually Madeline was on, so I'm going to unmute her. Madeline is going to share her 3 words that she selected for our overall theme. So we have more to add here. And Madeline is going into her 3rd year at naturopathic college. So she is a budding naturopathic doctor and sister here. Madeline, share your 3 words with us that you selected.
Thanks for that introduction, Tara. So for me, the 3 words that come to my mind when I think about confidence are courage, trust, and determination. And so we need to have courage to feel the self-assurance that comes with confidence. We need to have trust in our own abilities and qualities. And we need determination to harness those abilities and appreciate ourselves for who we are.
That's awesome. You are amazing. And so for our final wrap up, just remember that you can access all of our videos or all of the Sisterhood sessions, the full length and then the individual segments on our YouTube channel that we'll include in the notes following this. Pick 3 words that really resonate with you for this theme and just hold them at the forefront of your mind. And we hope you enjoy reading Elle Daftarian's 9 shifts and share with us which shifts resonate most with you. Take your vitamin C and practice your postural exercises and plank for higher health. And our gift for you, I don't know if it's really a gift, but it's letting you know what our theme for next week is. I'm super excited about this one. We have a sexologist joining us. So the theme is sex or sexology, energy, and hormones. So join us next week. We have an awesome lineup. And the other gift I have is Dr. Ashtanga Lisa Novambra, who is one of our movement experts. She is doing, I'm trying to unmute you here. There we go. She will be running a free yoga session on Wednesday mornings from 7:30 till 8, starting to walk you through our proper instruction of the sun salutations. And so that's just a special offering for everyone here. We'll send out the link for that. So that's at 7:30. Lisa teaches beginner yoga as well as advanced. And so she will help you do sun salutations, which they're a perfect way to start your day. So thank you so much, everyone, for joining us. We help you and just carry confidence out into your day and your week. Thank you to all the panelists. You're awesome. And yeah, have a great day, everyone.
Thank you.
Bye.
Bye. Thank you.
All right, I think I'll just end the meeting here.